and there will be have come forward, and I'm collecting their stories, and I'm collecting the stories of the family, so that the families that this has happened to, so that when there is a reckoning, and there will be, that I've got that information to be able to pass on to people. So today what has happened is I had a whistleblower contact me, who I've spoken to. I've verified this person. They are a real person. They're not a nutter or some conspiracy theorist. People like to say that we're conspiracy theorists. This person is not. They're a real person. They are working in a home. They've given me their full name. They have given me the name of the home. I'm not yet going to release that to you guys publicly, because there's a process that we're going through. But that person has agreed that I can read out what they sent me, and I want you all to know that this is the truth of what is happening. So I'm just going to read her email, really, and then you can tell me what you think. So she said, "Hi Claire, thank you for the reply. I'm seeing my manager again tomorrow, and I'm telling her that this will be my last complaint before going to the CQC, which is the Care Quality Commission. But again, I'm not sure how responsive they will be. They don't seem to care. I'm worried that it's my word against all the GPs, the district nurses and the other carers. What I have to say is that they have put all our residents on do not resuscitate orders, and all of these residents with variable or lack of capacity are on anticipatory care pathways, which means that they are not allowed to go to hospital for any treatment, for anything, and they aren't to receive any antibiotics for anything whatsoever, whatever illness they've got. Since this pandemic, in inverted commas, started, we haven't had a single GP visit the patients at our home. Whenever anyone gets ill, and this is ill not related to COVID, because we haven't got it in my care home, they automatically put them on end of life. This is now what really gets me, and nil by mouth. And they discontinue all their medication because they say they're at risk of aspiration, which is ridiculous. Which is ridiculous. Because if they eat, drink or have medication, there is a small chance that they could aspirate. But if they're nil by mouth, then they will die from dehydration and starvation. Myself and another carer on nights have had to resort to buying jars of pureed baby food and feeding the residents and giving them drinks after making them aware of the risk of aspiration and getting their consent, just so that they can have food and drink. Sorry. Along with this, the GPs are remotely prescribing end-of-life medication, which is morphine and midazolam injections, and these are being misused. All our clients have had their usual medication taken away, which is regular pain relief such as paracetamol and codeine, and all their anxiety, antidepressant and antipsychotic medication, which a lot of our clients are on. The district nurses then come into the home to give end-of-life drugs, because with the withdrawal of usual medication, the resident is showing signs of pain and anxiety, which of course they would. The morphine should only be used for extreme pain when nothing else helps, and this knocks the individuals out, and especially when they're not eating and drinking and losing weight. This means it's even harder to get any fluids in them. The midazolam is given at end of life for sedation and terminal restlessness and agitation. However, this suppresses the individual's breathing and quickens along their death. No other alternatives of pain relief are given. There's no pain patches, no liquid paracetamol. They just put them straight onto the hard stuff, which once started is only a matter of days before that resident passes away. However, this has all been okayed by the doctors and the nurses, and as the need for analgesia is subjective, I don't know how much evidence I can find, or even if I will be believed, but I have collected evidence of fluid charts. I've worked in this home for over 2 years, and I have never seen anything like this when it comes to end of life and just writing people off. I believe it's a human right to have right to life, and they are committing euthanasia. So much for them protecting the vulnerable.